Hi, Dr. Adler here, and today I'm going to talk about the anatomy of a tooth. Sometimes you go to the dentist and you open your mouth and they do their thing and you don't really know what's going on in your mouth. So I just want to give you a little basic dental anatomy 101 lesson. I'm going to do it using an x-ray, and this is an x-ray of a person's upper right teeth. These are the two molars in the back, and these are the premolars. And the anatomy of a tooth involves three layers. There's the enamel, the dentin, and the pulp. The pulp is also called the nerve. It has a few names, but those are the basic names. So on an x-ray, the white part is the enamel, and that's the hardest part of the tooth and the hardest part of your entire body. The next layer is called the dentin, which becomes much softer. And that is why if you get a cavity here in the enamel, sometimes as the dentist, we don't do anything about that unless we see it spread into the second layer, because it can sit in your enamel for a long, long time and never cause you a problem. But once it gets into the dentin, that's when we have to drill out the cavity. Sometimes cavities get really big and they get into the pulp or the nerve canal. And that's what this black hole is. And that's where the nerve is housed. It's also called the pulp because that is the nutrients that keep the tooth alive. So if you have a cavity that goes all the way to this area, that's when you need a root canal. I'm sure you've heard of root canals. So once that happens, then the root canal specialist would go into this canal and pull out the nerve and fill it, which I will show you in another video. But today we're just talking about the anatomy. This is your jawbone, this little matrix, and this is what holds your tooth in. Your tooth is not part of the jawbone. Your tooth is held in by millions and millions of tiny fibers at this junction right here. And at this junction, that's how your tooth stays in your mouth. So if you have a perio problem, sometimes this junction, the fibers get broken. And that's why you have something called a perio pocket. So to recap, dentin, enamel, dentin, pulp or nerve, and this is your jawbone, and there are millions of fibers holding your tooth in, which is also another reason why when we pull your tooth, someone can just go in with a forceps and pull it out and not break half your jaw off because just the fibers are broken. Anyway, thank you and subscribe.